Coming to appendix. Appendix, as you know, it is a vestigial organ. Sometimes it get occluded by the stones or by this fatty deposits. So the patient might develop an inflamed condition called as acute appendicitis, which might also go for a perforation or a rupture. Here you should understand appendectomy can also be done in as laparoscopic or as open technique. Here what you need to know is like what is the technique that is being done and is it medically necessary. Sometimes what happens, a female patient presenting for a hysterectomy or a oophorectomy, at that time the physician might also remove the appendix. In this case, we are not supposed to code the appendectomy because here the appendectomy is an incidental procedure. There is no medical necessity. So you will have to see the pathology report and see if there is any inflammatory condition or any abnormality of the appendix so that it can be a billable service. Again, you need to understand whether this appendectomy is done as a standalone procedure or is it done along with other major procedures. In that case, we have a plus code, an add-on code where you can report it along with the major procedure. Next, we also have a code for a ruptured or a perforated appendix, that is separate, or an appendix which has developed a peritoneal abscess. For that cases, we have separate codes.